everyone, and welcome to the third WEGO Health Activist Roundtable. I am Julie Flagar, and I am a narcolepsy spokesperson, along with the author of Wide Awake and Dreaming, a memoir of narcolepsy. And I am just so excited to join you tonight. I'm in Los Angeles, but I am joined tonight with Josh Robbins, who is an HIV-positive health activist and a blogger at I'm Still Josh, and the author of an ebook, HIV Won't Kill Me, encouragement book. Hi, Josh.
Hello, how are you?
Good. Thank you so much for joining us.
Thank you for having me. I'm excited.
I'm also joined by Jordan Davidson, an endometriosis and women's health activist. She is also the editor at Everyday Health and the co-founder at Endo Warriors. Hi, Jordan.
Hi, Julie.
Thank you so much for joining us. And we have a great panel today and a lot of great questions, lots of tough questions. But before we get started, I want to introduce Danielle from WEGO Health.
Hi, everyone. Thank you, Julie. I'm so excited that we're actually finally in episode 3. We've had some great panelists and topics so far, but I just want to introduce myself like I do every episode. I'm the community recruitment manager here at WEGO Health, which means I get to work with all of the community on multiple programs and all of our social media channels. It's my favorite part of my job, and I was so excited that Julie wanted to host because she did this excellent job as a guest a couple weeks ago. And then, of course, she also is a Geek Health Activist winner for the 3rd annual WEGO Health Activist Awards. And I'll come back in at the end of the episode to tell you a little bit more about the awards and remind you to watch and share and tweet and all of that. And then Jordan and Josh are just really excellent health activists from different condition areas. So I'm excited to kind of dig into the deeper topics. I have my co-pilot here, WEGO Josie, who's going to be listening in. But otherwise, as I say every episode, I mean, why we do this here at WEGO Health is to give all of you a voice. And Google Plus has become our largest channel online. And what better way to have you guys interact but visually through the Hangouts on Air. I want to give a thank you to all of you for being part of this tonight. I know it's late for some of you. And also for my team here at WEGO Health and all the health activists and who've helped us along the way. So I'm going to let Julie take it from here, and I'll jump back in towards the end. And thank you all for joining us.
Thank you, Danielle. It's so exciting to be a part of the WEGO Health community because I think for so long there were so many things that I thought were just narcolepsy. Different complaints or things like no one knows what narcolepsy is or no doctors know what it is. And then you talk to other health activists from different communities and learn that we have so many things in common. So it's really great to be part of the WEGO Health community and to be joined by Jordan and Josh tonight. I wanted to ask Josh and Jordan to share a little bit more about themselves and their efforts. So if, Josh, you want to start, I have one tough question to start. Well, hopefully not too tough. I wanted to ask, tell us a little about yourself, and also what is the one thing that you would want someone to know about you and your condition that, is really just the burning one thing that people misunderstand.
Well, first, thank you, Julie, for having me on, and WEGO Health for asking. You guys are amazing, and I'm excited. So, and it's a cool platform that you guys have had as well with the Health Activist Awards and recognition. I know for me personally that a lot of time when you are working kind of in the work that we do as activists, which sometimes feels a little weird for me personally to refer to myself as. It feels good sometimes when we get the opportunity to work with WEGO Health and other organizations and kind of recognizing each other and that sort of thing. So like you said, I am Josh, and I have a blog called I'm Still Josh, and the reason why I started that blog was because a couple weeks after I got the result of an HIV test and I found out that I was living with HIV, I searched online for a cool, young, hip, fun, but factually correct regarding health information website or blog, and either I wasn't using the right search terms or I couldn't find one, and because there wasn't one. So I don't know which it was, so I just started a blog on a Thursday morning. I remember being in the shower and going, oh my God, I got to start a blog. And then I went to my office and I sat there and I said, okay, like, what is it going to be called? What is it going to be about? And I'm Still Josh was kind of what I landed on. And it's because simply that I wanted my friends to know that even though I'm living with HIV, that I'm still exactly the same person, and that I want them to still be the same person. Meaning, like, you don't have to ask me every day, like, how I'm feeling, or how is my health, or, you know, that kind of stuff in general. But I landed on that, and a couple weeks after I started the blog, which I launched on Facebook, on my personal, you know, Facebook page or profile, I had about 300 friends, I think, at that time, and that particular day, I guess everyone shared it, and they went back to it and visited it again and again, and it hit WordPress's, like, one of their fastest growing blog lists for that day. I think it had like 1,800 views, which I was thrilled about, and then didn't realize kind of what that meant for me, kind of going back. But I had actually recorded myself before and during and after I got my diagnosis. Personally for me, but my mom's a registered nurse, and she's actually, I made her a blog, and she's a blogger now for MS. MSLisasays.com, so check it out. Okay, Mom, I gave you a shout out. And anyway, I recorded what the physician told me that day about my diagnosis, and I recorded it because when I went home to my hometown from Nashville to Jackson that day, it was important for me that if it was a positive result, which it was, that I was able to share that information completely with my family, because we're very open about health. And so I did. I shared it. But a couple weeks after starting the blog, I remembered that I had those recordings, so I edited them and shared it on YouTube. I didn't know at the time, but on YouTube it was actually, and I think it still is, the only actual recording of someone, you know, finding out live or recorded live that they are living with HIV. And I felt that it was important for that experience to be heard and visualized and shared, because when I found out I was living with HIV, I was 29 years old, and I never met someone that had told me that they were living with HIV. And so I thought that it was an opportunity to really visualize and kind of take someone through what that feels like and what it meant for me. And that's kind of what has fueled the blog. I'm Still Josh. Now it's very weird to talk about myself in third person, to be honest. But quickly after starting the blog, I also realized that I'm pretty boring, and I could only share so much information about me. And so I wanted to use that platform to really encourage and empower and speak life into other individuals that are living with HIV, and use that platform too to allow them to share their experiences and their journey and what they're feeling like and the struggles. And so it's been a kind of a cool, compilation of not just stories about me or things that I think are interesting, or topics or videos, but it's actually a platform where other individuals are able to kind of share their information. It all spans from something pretty simple, which I think as a whole can go across many different, illness or medical issues, which comes down to basically encouragement. It's my belief that if you offer someone living with HIV or MS, for example, encouragement right when they find out that that's an issue that they're dealing with, then what it does, particularly in HIV, is that a topic that is sometimes quiet or more a cause or a ribbon to wear, it becomes very real. And I know that because it's kind of ignited several other guys in Nashville that are now bloggers and then also nationwide, it's kind of launched people. And so it takes a moment of people feeling insecure, insignificant, depressed, disappointed, and it kind of rotates that, and it makes them homegrown, hometown activists sharing their stories and making HIV very real in their own lives, in their own community, and kind of putting their face locally on it. And from there, I've found an insane resource of opportunity to talk about HIV and have those conversations that otherwise I never experienced for 29 years.
That is so awesome. Thank you so much, Josh. And Jordan, would you like to introduce yourself, please?
Sure. So I'm Jordan. I'm a women's health activist. I'm also an editor at Everyday Health and the co-founder of Endo Warriors. And I guess I will start with Endo Warriors, since March is Endometriosis Awareness Month, and if you check out our Endo Warriors page on Facebook, we have been going insane raising awareness for endometriosis. And we've been posting an endo fact every day, which has become so popular that if I miss posting an endo fact, I get 5 people asking me where today's fact is. So what Endo Warriors is we're a support organization for women with endometriosis, and we provide monthly meetings right now we're in New York, New Jersey, Pennsylvania, and Colorado, and soon we will be expanding to the Netherlands as well, and some other states to be announced. And we provide monthly support group meetings where women can just come and kind of talk about the things that would probably make people uncomfortable who don't have endometriosis, just because, you know, a lot of people aren't comfortable with period talk, and that's pretty much all we do. So it's a really great support environment, and it allows women to, you know, talk about things with women who understand. And for a lot of people who come to our meetings, they're like, oh my God, you know, it's someone else who knows what I've been going through. I've been, you know, waiting this so long to have someone who understands. And so, you know, that really in itself has been great. So a lot of work in the women's health arena. I also am the blog editor at Everyday Health, and I cover women's health and digestive health as well. And sort of being at Everyday Health has been wonderful, and sort of my pet project, I like to say there, is I run a blog called My Health Story, and we publish stories from anyone dealing with any illness. We've had stories about ulcerative colitis, Crohn's, MS, you know, from rarer things such as PKU, a lot of other rare diseases that I'm not going to embarrass myself by trying to pronounce right now. But, you know, a lot of really great contributors we've had, and I'm always looking for new people to contribute, because I really believe that there is power in sharing your story and in kind of the art of catharsis, and being able to know that by sharing your story, you're not only helping yourself by kind of relieving this, like, oh my gosh, I'm bottling all of this up inside, by not, you know, being able to feel honest about who I am and by expressing myself, but also by knowing that there's someone out there. You know, the internet reaches so many people. There could be someone, you know, as far as Malaysia who's reading your story and says, oh, that's me too, and now you're helping, you know, people that you didn't even know that you could reach. And I really think, you know, for digital, which is why I'm so passionate about digital health, is the number of people that you can potentially be able to reach, and how, you know, by sharing patient experience, we can really change digital health and medicine, modern medicine.
Hello?
Yeah.
Hi. I think I lost you guys there for a second. Did you guys lose each other, or was that just me?
No, I still had it.
Okay. I guess it's just my connection. Well, Jordan, I heard most of what you said, I think, about everyday health and helping other people tell their stories all over the world, that you can reach people. So I think that, it's just so interesting. We all have so much more in common than I know I ever realized, because, for me to start a blog about narcolepsy in 2009, I didn't know at all that I was going to reach other people with narcolepsy. I thought that I was telling my friends and my family and trying to get donations to run a marathon. And then to have all these other people all over the world find my blog and say that, that was the first time that they felt like they weren't alone. It was just such an amazing feeling. So, people say to me now, like, oh, you're so brave to have done that. And I guess I never really felt super brave. It just, once you start getting all that positive feedback, it seems like such an easy decision. But, it's just so interesting to hear both of your journeys to getting to where you are now. It's really impressive. So we have a few headlines to go over, and before we get to our main topic, so we're going to go over a few news headlines. And the first we were going to discuss were the new FDA nutritional guidelines that just came out about a week ago, and there are going to be some changes for the first time in a very long time to guidelines, including size requirements. So, oftentimes when you get ice cream, it says, the size is like half a cup or something ridiculously small. And then also they're going to have to disclose more about added sugars and total calories, and also listing nutrients like vitamin D and potassium and sodium. So that's our first topic. I don't know if either of you would like to give an opinion on this and how this, these are just suggestions, I guess, at this point, and we'll see what happens when they've finalize these. But do you guys have any opinions on that topic?
Well, kind of on a funnier note is that when I saw, so working in a newsroom, it was kind of big news that day that the FDA had changed the nutrition labels, and everyone was all excited about it. And I looked at them, and then I looked at the old ones, and I looked at the proposed new ones. And I was like, oh, they made the font bigger. I was like, yay, now I can read the nutrition labels. And that, for me, was pretty much the extent of my reaction to the changes in the nutrition labels, because I think it's still a lot of the same information, and without having proper education about what a healthy diet is, making things a little bit clearer for people who you still don't understand the information. So making it clear doesn't necessarily help, and making the calorie size font larger only helps the people with bad eyesight who don't know the nutrition labels.
That's a great point.
I think it's interesting. When I saw the headline, first, let me just say this from the very beginning. I kind of don't adhere to regulations ever. I always am like the rebel. So I am certainly not the world's power on labeling anything. I always drink milk, probably way too many days after you're supposed to. Anyway, with that said, I don't know. I'm about responsibility, decision making, and just information. And so, if it's information that people find helpful, fantastic. I think I don't know. I don't know that it's after 20 years of not making a label change, it's a big deal. But ultimately, there are people like me, I'm sure, that really don't understand the majority of what the label means anyway, except like sugar. I know that there's good sugar and bad sugar, but when you look on the label, I feel like that maybe it just says sugar, and it doesn't kind of give me the information that I would need to make a decision anyway. Or I just need to invest in better educating myself on healthy habits. So maybe I'll check out, Jordan, some of your information on it.
Yeah, I don't have too strong of an opinion about it. I think the only thing I thought was good is, if you have a can of soda or, something like that where you're going to open it, you're going to drink the whole thing, it seems pretty silly to list, a size is half of a can of soda or something as a, size. because everyone drinks the whole thing. So maybe that'll help a little bit with the math, but I totally agree. You know, what we think of as nutrition or health, it really varies from person to person. So it's, you know, somewhat difficult to know if these are going to be super helpful. But the next headline we want to discuss was that the Million Women March on March 13th. And Jordan, if you want to tell us a little bit more about this.
Sure. So the Million Woman March it was worldwide. In the U.S., women with endometriosis met in Washington, but it was really a global effort. A lot of places, Canada, Poland, Jamaica, we saw a lot of insane photos from all over the world, and meant to kind of increase awareness for endometriosis. And for those of you who don't know, endometriosis is a reproductive condition where the lining of your uterus is found outside of your uterus and kind of adheres to other organs in the pelvic region and causes inflammation, chronic pain, and most women, these endometrial spots are just found on the uterus and outside of the uterus, and the ovaries and the fallopian tubes, but they can be found on places such as the bowels, the liver, and in extremely rare cases, the lungs and the brain. So it is, it can be a very serious condition, and the awareness for it is pretty much non-existent. Much more so, there's a lot more awareness now, but in the past, it was really just bad. People said like, oh, you just have bad cramps, and the average diagnosis takes 7 years. Because it's just, toughen up, it's all in your head because you're a woman. Every woman gets her period, and so, maybe you're just a little bit more sensitive to, having bad cramps, but now we know that it's not bad cramps. And so a lot of women throughout the world gathered together and raised awareness for endometriosis. And I know a lot of women who went to Washington. I unfortunately was unable to go, but a lot of women, they had over 2,000 women with endometriosis show up in Washington. There was a huge turnout, I think, in Jamaica. I mean, photos from so many different places of just women who were tired of, being told it's all in your head or it's just bad cramps. And so that really, hopefully that there's a overwhelming response, beyond March. I know that a lot of people heard the word endometriosis this month, so hopefully, all of that work was heard.
I think it was definitely heard. I loved your facts on Facebook. I saw those and, super impressed and thought, oh, we have to do this for narcolepsy too. So, and I watched some of the videos from Washington, D.C., and I was hoping that you would be there. It looked fantastic. It looked a little cold, I must admit, but it looked quite awesome. Yeah.
I was told it was extremely cold, but there was also a lot of flash mobs. There was some in New York and some in Washington, and actually Endo Warriors. We did a fun flash mob too for the women who couldn't make it to DC, but it was really a great turnout.
That is so fantastic. It seems like March has a lot going on, and there was also National Women's and Girls HIV and AIDS Awareness Day. And I was hoping Josh could tell us a little bit more about what was happening there.
Yeah, absolutely. First, I just want to bring up the point that, you probably feel the same way, Julie, and you kind of mentioned it or alluded to it a little bit, Jordan, is that I've noticed kind of in the health community in general, well, not in the health community, but there's so much education about specific conditions or, niche conditions almost that don't affect everybody, but really affect everybody. And there's so much stigma, around different, just issues or unnecessary, negativity. Have y'all noticed that? It's like, come on, people. Like, you may not have, I may not have, I can't even say it, but Demetrius. Exactly. But, or I may not have narcolepsy, I have HIV, but, like, people make jokes about all kind of stuff, and trust me, I'm all about joking. But at the end of the day, it's, I just feel that kind of just stigma in general kind of crosses boundaries, and it's just unnecessary. And so I hope people in general just kind of start recognizing that. But anyway, I'm off my soapbox. So March 10th was actually, and I'm going to cheat and look at some of my notes on it, but March 10th was National Women's and Girls HIV/AIDS Awareness Day. Luckily for HIV, I feel like that we have like a day every highlight a particular community within the HIV community in that space. But I was really, really surprised by some of the statistics and facts about HIV and how it relates to women, and particularly heterosexual women. And some of those facts were like 1 in 4 people living infection in the U.S. are women. I'm gay, and so naturally, when I think about HIV in that space, my mind doesn't go to children, it doesn't go to women, it doesn't go to women in, lesbian relationships, which all of those groups are affected by HIV. It goes to, gay men. But 1 in 4 living with HIV in the U.S. are women. Most of the new infections of inside that circle of women are from heterosexual contact. So straight sex, I guess, 84%, which to me still wasn't surprising, but it's just a little education. And then only half of the women who are diagnosed with HIV are in care, and even fewer, only 4 in 10, have the virus under control, meaning that it's undetectable. So they're in treatment, they're on medication, and they have it under control. 40% for being under control is a terrible number. It needs to be higher. And then only 50% are in care. So we can't get it under control unless we get you in care. And so that day was specifically a day. The whole month really is Women and Girls HIV Awareness Month. But the March the 10th is the day kind of designated to really raise that awareness and the resources. And so I thought it was really cool, and I saw a lot more collateral and social media. I mean, that's kind of where I reside, is that social media digital space, because I'm a nerd for Google and analytics and search engine optimization, all that stuff, which my partner, by the way, hates. He hates for me to even talk about it. But I saw a lot more engagement in kind of local AIDS and AIDS service organizations or HIV community centers or that sort of thing, and even state governments really putting more resources into that educational opportunity and awareness opportunity kind of nationwide when I was kind of searching through stuff. And I thought it was really cool. A lot of the campaigns, I feel like, unfortunately, sometimes coming from the government aren't always the coolest campaigns sometimes. But I think that this year the creative was engaging enough, and they put out the right social toolkit for that engagement on the local level. So I thought it was pretty cool.
Yeah, it was so exciting reading about both of these days and seeing what was happening in the different communities. And you guys touched on exactly what I found. There was great government websites, and of course in the sleep and narcolepsy community, I'm looking at those government websites like, oh my gosh, how do we get one of those? But then of course, like you said, they're not always the hippest. But it's just really great information. March was also the first week of March was National Sleep Week. National Sleep Awareness Week, and March 8th was Narcolepsy Day. It's called Suddenly Sleepy Saturday, and so these were really big days in our community. It's just interesting, opportunities to raise awareness about sleep and narcolepsy. I'd say this was by far the busiest that we've ever had in our community. There was so much going on with events in Ireland, and I'm starting a new nonprofit called Project Sleep, and we hosted 5 sleep walk events all over the country in Florida, in Texas, Alabama, and Hawaii.
Wait. What is a sleepwalk?
A sleepwalk is an event where you go for a walk and raise awareness about sleep health and sleep disorders. So there actually were people in pajamas. They wear pajamas to the event, and awards for the the greatest costume, or sleep spirit signs. People made great signs for the event. So it's just to highlight the fact that sleep is considered one of the most important things about health, along with diet and exercise. But you hear a lot about diet and exercise, and rarely do people ever really talk about sleep. So that's been one of my main missions, is getting people to start talking about it. And the interesting thing is that when you start getting people together, so many people have sleep disorders and issues sleeping. And we just kind of brush it under the rug a little bit and continue with our lives, but it can be a problem with driving. It can be, it can really affect people's lives. So it's been really exciting to try to create events. When I created the sleepwalk, there was really nothing going on. There was no events anywhere to raise awareness about sleep during Sleep Awareness Week. So this is now the 4th year, and we had 5 walks. So definitely a great success, and I already feel tired thinking about next year. It's really exciting. It's just a lot of work.
Will you add a virtual sleeper walk, so that if I can't be there to walk in person, that I can sleep when I'm sleeping, but raise money, everybody talks about wanting to raise money when you sleep. That is the way to do it, via the virtual sleepwalk. Yeah.
That's perfect. So I'm gonna have to take you up on that. That's a great idea. Yeah, I hosted I hosted an event where a Google event, so people all over the world could be together, and I got some pictures back of people lying in bed watching my broadcast in Australia, because it was early morning there. So that was really, really, really neat.
So are you saying right now that this is the official announcement via this Hangout with Google Health that you're adding a virtual sleep? I want that commitment, and then Jordan, you're able to report it exclusively.
Oh, as long as I have the exclusive reporting right, then it's a deal.
If anybody else is watching, don't write anything yet.
I think that sounds so fantastic. There's no better way to raise money than by sleeping. That sounds like maybe I could do some sort of a sleep-a-thon, because I am really good at sleeping. So I could probably beat anyone out for time, and I think it's a fantastic idea.
That's awesome.
So we have one more news topic to go over. It's the measles outbreak in New York City, and I believe, Jordan, you're in New York, so I don't know if you've probably heard more about this than I know other people. There's been 20 cases reported in New York City, and including 9 kids. And I know that as of 2000, we thought that we had measles eradicated in the U.S., and now it seems to be coming back with increasing cases every year. So, Jordan or Josh, did you want to add some input on that?
So I am from New York City, and fortunately I don't have measles. I think we also had a mumps outbreak, if I remember correctly, recently. I think the thing is when we think we eradicate something, it's because so many people are vaccinated, and so we don't see them, and the cases are so few and far between. But there are a lot of a lot of people are hesitant to get their children vaccinated now, and so it's not a huge surprise that these things do come back. I read that out of the 9 children that had developed measles, 2 hadn't been vaccinated, and the other 7 were too young to be vaccinated, and with the outbreak, that's why they got it. So I think that the lesson that we can learn from this is that if we don't want there to be a measles outbreak or a mumps outbreak or any thing that's covered by the measles, mumps, rubella vaccine, then it's important to get vaccinated.
Definitely. Josh, did you have it?
Well, I mean, full disclosure, I don't know anything about measles or mumps, because I thought mumps were measles and measles were mumps. And then I think there's something like rubella, which I thought that went with peanut butter. So I don't know much about that, but I know for a fact that I don't even know this for a fact, but I think I was vaccinated. So is this I know there are people out there probably, they're like me that just don't know, have I already been vaccinated for all that, or is this something brand new that I got to be revaccinated for? Is it like the chicken pox? Once you get it, you can't get it again? Or did I ever have it?
I think you were probably already vaccinated for it. I think the vaccine has existed for a number of years now. So you were probably already vaccinated. It's sort of like the chickenpox vaccine. I think it's something that they give to you, you know, in your early, under 5 years of age, sort of, when you get all of the different shots and boosters and all of those things. But
Well,
I don't know.
so, okay, do we know if it's a new vaccine, or did the old vaccine not work, or are people just not vaccinating? Is that why this is happening?
Recently, people are just not vaccinating. It's not a new vaccine. It's a fairly old vaccine.
Is this
Yeah.
one of the vaccines that I know that there's been a lot of kind of talk in vaccination circles or anti-vaccinations. Is that why people aren't being vaccinated for this?
Yeah, that was a part of it. I believe that there was, concern about a link to autism, so that were some of the cases in 2013 seemed to be linked to people that had chosen not to vaccinate their children because of that issue. And it's an interesting issue actually in the narcolepsy community, because narcolepsy has been linked scientifically to the H1N1 flu vaccine and the virus itself. So it's actually, what they're learning is it's most likely very much a part of the development of the disease, that people, it's an autoimmune disease, they believe, so that you would get a upper airway infection like the H1N1 flu or strep throat, and by accident your brain misinterprets that and would be trying to attack that virus, but instead would attack brain cells, and the very specific brain cells that called hypocretin, and that loss of those brain cells leads directly to narcolepsy. So it's actually been a huge issue, especially in Europe, where kids that were vaccinated with the H1N1 flu vaccination ended up developing narcolepsy in much higher numbers than normal. So of course, also, it's not just the vaccine. If people developed just the flu itself, what happened in China was that people developed the flu itself, and that also led to narcolepsy. So, but it's kind of this interesting issue of, a vaccine feels like a choice, that you vaccinate a child. You feel like the parents end up taking on all this guilt, like, it was their choice to give them that vaccine, as opposed to just developing something like strep throat, or you get the flu, and then you could develop narcolepsy from that. But it's just a really interesting issue, and I see both sides. I totally see both sides. As someone that studied like health law and health ethics, like vaccination seems like really, really important for the safety of the general public. But then on an individual level, I can't say I've gotten the flu vaccine myself anytime recently.
Well, and then so, I mean, just being relational now and finding out, kind of these things, it seems to me that there's a real problem, because people have both sides kind of pulling at them with their own kind of activist reasons for being vaccinated. So where is the middle ground? Where does somebody that didn't know any of this, like what do you get? What do you do? Do you get your kid vaccinated? Do you not? Do you want if your kid's going to get a condition later on? But at the same time, I'm sure that some of these parents of these kids in New York may be wishing that they had been vaccinated, right?
I think the majority of pediatricians, and the vast majority, would recommend getting a measles, mumps, rubella vaccination. It's kind of, at least what I know from the health community, is it's just one of those things that it's kind of like, you're a child and you go and you get your yearly physical and you get your vaccines, and that's one of them. I think it's recent with the autism and all of that stuff that has come into light with, be it political or, in the health world, that people have been saying, wait, maybe I don't want to get my kids vaccinated. And I think science really hasn't taken, a stance towards saying, no, don't get your kids vaccinated because they'll get autism. It's still, I think most physicians and scientists still stand by at least the measles, mumps, rubella vaccine.
Yeah, well, I mean, well, one thing to add too is that what I've found, specifically in HIV, there is something that's not a vaccine per se, but it's a prevention tool. It's taking basically the medication that you would take as if you were HIV positive in order to prevent HIV when you're HIV negative. And there are same concerns going around and different arguments happening within the community. And without getting specific on the name of the drug or that sort of thing, I'm a huge advocate, and I think there is a middle ground for all of these things, which is just patient education, providing patients the education opportunity and having the resources to have those conversations between educated parties. So whether that's a patient advocate and their patient and a doctor, whatever, but giving that opportunity to really encourage, get yourself educated and then make a personal decision. And then whatever that decision is, there could be good or bad consequences because we don't know. We'll know in like 10 years or something. But beyond that, there's no judgment from any of us on that level of personal education based on information and then having that conversation with, someone medical.
Definitely. All right. I think we should move on to our main topics because we're almost running out of time, and I don't want to run out of time before we get to talking a little bit about how do you first tell someone about your condition. I feel like I know from my experience that can be really complicated. It's gotten a lot easier with time, but I'm sure you guys both get questions from other people in your communities. How do I tell my coworker? How do I tell someone on a first date? There's just so many different things. A family member. So
I think you do it real quick. You're like, hi, my name is Josh. I'm 31. I live in Nashville. I have HIV. I don't want any kids. And how about seeing a movie tonight?
I like it.
No, I'm just kidding. I think for me, that's actually a great question in the HIV space. It's when somebody's HIV positive, and I'm going to throw this actually back on y'all because I would love to know your opinion. If you're dating, if you want to date somebody and you don't know that they're HIV positive, how soon would you want to know that someone is HIV positive? Do you want to know before you get to know them kind of in that dating space, or would you want to know before you got to know them or after you got to know them, and as far as that? And it's a question that a lot of people in the HIV community that are living with HIV have to struggle with. I don't consider it disclosure because disclosure is a legal term regarding disclosing HIV in the criminalization aspect of the virus. I see it as voluntary coming out kinda almost. But when would you two want to know that somebody was living with HIV if you were going to date them?
I guess I would want to know soon, early on. Maybe it's just my personality, but I feel like I guess from my personal experience, I want to know what's happening with people, and if I'm going to be supportive or not. I think that should just get started. Like, get that conversation going as early as possible, because I think there's some people out there that are going to be really supportive and want more education, and there are some people that aren't. And so I guess if I were HIV positive, I would just want to get that started as soon as possible to figure out if this person is going to be, like a good person to be with. I don't know if that exactly answers your question. It's tough.
Yeah, it does.
And I agree with Julie. I think I would probably want to know sooner rather than later. I think that I talk about this a lot. I think that there's a point of where, and it's different with different people you meet and in different sort of relationships, but there's a point where it's good to tell someone, and then there's a point, where it's too soon, and then there's a point where it's not soon enough. does it reach a time where then, you can't wait too long where the person feels like they're being deceived? You don't want to keep someone along and then just be like, oh, by the way.
Yeah, well, and I agree, and thank you for sharing. My opinion on it is actually the same exact that you have. Is that particularly with HIV is I think there's such a thing. People always say, "Oh, Josh, you're so positive," and then I'm like, "Well, duh, I have HIV, so I am HIV positive." That's a conundrum in itself, but
Good
as
one.
I know, I make HIV jokes all the time, like you're raising my viral load when people are stressing me out. It's how I deal with it personally, which I've taken a little bit of, slack from people, but that's all right. But I think it's important for me to be able to maintain that sense of power kind of over the virus, and in being empowered to keep living and living well and being happy. That I want people around me that support that same kind of model. And so that's the reason why I chose to kind of come out of the closet as being HIV positive. I don't recommend that for everybody in the way that I did it, like via social media, via a blog. I mean, it doesn't have to be as small as that, grown really fast. But it could be telling the person that you're interested in, so that from the very beginning if it's a wasted moment in time, if that person is educated enough to be able to know that actually people that are HIV positive in treatment and have an undetectable viral load have such a small risk of transmission, via the partner study that just came out, that those aren't the people that are, basically exposing other people to it. Most people would know that. I didn't. I will tell you too, though, in full honesty, that I was somebody, unfortunately, when I was HIV negative, if somebody told me they were HIV positive, my reaction would shock people now. But it was because I was uneducated and I was dumb and ignorant to what it was. But in hindsight, looking at it now, and what I think is the best way is exactly what you said. If you're going to kind of stay positive about whatever issue you're dealing with, it's cool to just come out and talk about it. And then if those people are on team or off, and if they're not, then kick them, to the curb.
Exactly. Jordan, I read a really great post you wrote about coming out of the closet, disease-wise, and so I'm excited to hear what you have to say. If your opinions have changed with time, I think you had mentioned like at an earlier age, maybe you would have had a different opinion. So tell us your opinion.
For me, actually, so I wrote that the post that you read a year ago, and a year has really brought around. I feel I was definitely more open a year ago, probably because I was doing a little bit less professionally, and Endo Warriors hadn't started yet. And I guess when you're surrounded by a community of so many people who deal with the same thing, it's kind of like, oh, I don't really need to talk about it because like we all have it here. And so many people in my life were endometriosis patients, and so I started talking about it less. But it's definitely something that's hard. I feel like if I could, I have endometriosis, and I was diagnosed when I was 12, and I'm 22 now. And if I could talk about it to anyone and have them be like, oh, okay, cool, like, oh, you're in pain a lot, and like that's, whatever, then that would be fine. I think it scares people a lot, and I think the way that you tell people and the way that you explain it to people has a lot to do with that. But when it's something that has no cure, and you don't know what you're going to do, and if you're not on medication for it and you're not really doing anything for it, if you're not, I was in a period where I wasn't really helping myself, and so how can, like, then other people don't know how to help you either. And so I kind of stopped talking about it because I didn't want to talk about it. I didn't want to go to the doctor. I just like kind of wanted to go about my day and be a normal person. And so like I'm not going to talk about it. I was dating someone for almost a year, and I didn't even talk about it then. So, when you have an invisible condition, you can go about things not talking about it. And it's not talking about it is not a great thing to do. But for me personally, I don't tell people soon. It's not the first thing that I say to people because I don't want people coming to decisions for me or about, is, you know, because it's associated with periods. Women get their period once a month, so I don't want people being like, "Oh, is it that time of the month for you? Do we need to lay back?" Or like I just want to go about my day, and like if I can't go out tonight, I'll tell you. And so until I feel that I've reached that point with a person, be it a friend or someone that I'm seeing, I don't really feel the need to bring it up. But I don't think that my method is the method for everyone. It's really just about when you're comfortable and wanting to do what you want to do. And I want to live my life the way that I want to live it. And I don't want to have endometriosis. I wish I didn't have it. And so some days I live my life like I don't have it, which means not talking about it.
Definitely. I think for me, the first 2 years of having narcolepsy, I told a few people, and I didn't like their reactions, so I just stopped telling people because of the jokes. It's just so funny to hear, the kind of things you get in other communities. Because for me, people would say, "Oh, you're going to fall asleep right now," and like Josh said, I have a sense of humor, but actually thinking my disease is in itself is a joke is a different thing, and that just got so frustrating. So I just stopped telling people, and like Jordan's saying, it almost helped me feel more normal in a way that could just kind of like push it out of my life a little bit. But then I decided to write a memoir about having narcolepsy when I graduated from law school. So all at once I moved to Washington, D.C., where the first question anyone asks you out at a bar or a social gathering is, where do you work? Like what section of the government do you work for? And my answer is, I'm writing a memoir. And if people don't ask you what about, like that's a pretty, okay, that person's probably not all that interesting. So most people do say, oh my God, you're writing a memoir, what's it about? The next answer, it says about narcolepsy. So pretty soon into writing my memoir, I was telling so many people, not really like I wanted to have the discussion with anyone, especially at like a loud bar or something. But what I found so interesting, and I don't know if you guys had this experience, is that you just really can't tell how people are going to react. Like I would think some people would be so understanding based on other things we've talked about. And then, I remember getting my nails done one day, and this girl kept asking me questions, and the answers were I kind of tried to avoid it until eventually I just said, well, it's because I have narcolepsy. And we had this most amazing discussion. Like she probably learned more about narcolepsy than some of my good friends. So have you guys found that you really just can't tell people's reactions, like whether they're going to find this as educational or off-putting?
Yeah, yeah, well, definitely. I think I actually have a video on my blog, imstilljosh.com, that talks about this specifically. It's like, what do you say to somebody? And because I'm interested in the HIV space, that's what it's about. But what do you say to somebody when they tell you that they have HIV? Do you say, "I'm sorry"? And the video is very simple. It's like, no, you idiot. You don't say "I'm sorry" to me. You didn't forget my birthday. You didn't not open my door, because when I go on a date, you better open my door. No, it's not that. And I think it's because you have to educate people in how to respond and what to say. And I'm certainly not the one to talk about women's periods and how that reaction should be, except that I think a very safe answer to say across the board for anything, whether it's my mom living with MS or me with HIV or whatever, is just to say and mean it, I'm here for you. What do you need? If anything, it's a lot better than saying I'm sorry, because, like, get over it. No, I'm not on the needing sorry train, I guess.
And that's so funny because to me, I would love for someone to say something like "I'm sorry" over so many of the other reactions I get. So it can be so different. I guess it just I guess also I kind of wonder if those reactions, like how do we just move past whatever someone says and just keep going and like forget it? Because some of those reactions like still hurt. Like when people say, well, oh, you can solve it, if you pray, or you can solve it with yoga. I'm like, I've done a lot of yoga. It's not going to solve my narcolepsy. Like, how do we get past those and just continue educating because um, people just don't know what to say, right? Like, I
Mhm.
wouldn't know that it'd be better for me to say to Josh, like, I'm here for you. I think that's amazing. That's such a great thing to say, but how do we just kind of like move past that?
Oh, I just think
I
it's education, but it's also letting it go. I think the biggest thing with HIV, for example, is everybody talks about stigma, which is very real and true, even though you can't measure it. In reality, you really can't. But you just got to forgive some of that stuff too, I think. And that comes from a personal place where, however you get to that space in your mind, I think, right, Jordan?
Yeah, I agree with what you just said. And I think, too, is, for people who don't know what to say, um, try the thing that is the least offensive. Not your gut reactions. I think a lot of times when people hear something, if they want to know more, if someone, you tell someone, I have narcolepsy or I'm HIV positive or I have endometriosis, and the person who's listening on the tail end of that, wants to know more, there's a way to kind of go about asking, what is that like, rather than just being like, if you've heard one thing, not saying the most inflammatory thing that you know about that condition, because I think that that's people's knee-jerk reactions a lot. I've told people, like, I have endometriosis. I would tell people when I was 18, they'd be like, so you can't have kids? I'm like, well, I'm 18 and I want to have children not anytime soon, and so I'm not really trying, but like I'll get back to you on that, in like 7 years and stuff. When I decide to, there's only so much humor that you can use for, not, I don't want to say dumb questions, but insensitive questions. Really to take a step back and, try and think of what is the least inflammatory way to ask a question or to tell someone that you're there for them. And also, to understand as the person who's, sharing the diagnosis, that sometimes people can't be there for you, and there's nothing, it's terrible. I've lost people definitely who were unsupportive, but to know that not everyone is supportive about everything, and it's not a reflection on you, and it's not necessarily a reflection on them either. It's just life circumstances, and do you really want someone there who doesn't, know how to handle those things? It's like, you have a friend you call when you're going through a breakup. You have a friend you call when you want to go shopping. You wouldn't call your shopping friend when you need sympathy. It's something like that. And so, how you share your diagnosis is also really related to that as well. Be mindful of who you're telling. Don't, tell all the gory, intimate details of your diagnosis to your shopping buddy, because there's a chance, they're not going to be able to handle that.
Well, yeah, and they won't go to your blog and read it and help get your page views up. So,
I love it. Yeah, I totally agree. It's just so important. That message of, not everyone's going to be supportive is so important because I think a lot of people spend a lot of time, at least in our community, trying to get those few people that are like your shopping buddies to also be your narcolepsy supporters. And I've found with time, there's been so many new relationships that I've formed where people are so amazed naturally, like, by my narcolepsy and what I've overcome, almost like they see it better than I do. So trying to get, move past as quickly as possible, you know, those relationships where those people just aren't going to get it, but it's okay because you're going to find people who do. That's just a message I'm always trying to get across. And exactly, like I have my friends I like to talk about certain things, and then other people to talk about narcolepsy with.
well, and the last thing that I just want to make sure too, it's real important that anytime you talk about your health, that's the personal decision. And so just because there are people like us that do talk about it very openly and in, very digital and electronic ways that are easily found on Google, it doesn't make us, actually, I don't think, it doesn't make us a hero. My brother is on the way back from Afghanistan where he sat in a field for 3 days at a time. That, or I haven't ever saved anybody from the towers in New York. Those are heroes. So it was the right thing, I think, for me to come out and talk about HIV in the way that I did. But it was the right thing for me because I was ready and I could. And so if there are people that can't for whatever reason, particularly women, some women are in violent situations where literally their life would be on the line if they wanted to, be bold and come out and talk about it. It's okay to not talk about it too, and to not just, just do that wisely, whatever is right for you. Don't you agree?
Josh, I think you are a hero. So I don't agree with you that you're not a hero. Besides that, I agree with you.
Well, thank you.
But yeah, it's so different for everyone. And I guess for me, it took me a few years. And then once I made the decision, I knew what I was getting myself into. My dad was an employment lawyer, so he was very keen on me being able to disclose when, that would be appropriate with employers. And so for me, it was just in my gut, and every part of my body I had to just I had to come out, but that was just for me. And you're so right, people are in different situations, so it's really not for everyone. But one other thing I want to discuss, have you guys found that the way you tell it is important? I know for me, if I were to say, well, I have narcolepsy and it's this really awful disorder, and you sound really down about it, then people will react that way. And if I feel like now I almost have like this pitch, like I'm trying to sell a car or something, like, I am a narcolepsy advocate, and I am really proud of the adversity I'm overcoming, then that helps people see the positive and see that, you're not a Debbie Downer, and that you still are, a very active person and positive. Have you guys found any difference in how you tell people?
I definitely think that the way that you convey it, if you say, positively, I'm living with this, and it, I still am able to do this, 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 and this, and, it doesn't, some days are bad and some days are not, and, it's just everyone can have a bad day, and it's really, people see you the way that you see yourself. So if you put out there that, it's that it's this terrible thing, even if it is a terrible thing, then people are going to view it the same exact way that you say it. And I think that when I was younger, I definitely, because I was more scared because I didn't know what was going on, I kind of said it in like a scarier way, like it was the end of the world. And so people kind of responded that way and were really scared for me because I was really scared for myself. And now it's kind of just, sometimes I tell it like, I said like, oh, I woke up this morning and I like poured some orange juice and I have endometriosis. And it's so nice outside, I think one of those sort of things. And if you say it like that, sometimes it can diminish what you've gone through. And in that, aspect of it, when you put it out there like that, then when you say like, oh, I'm not feeling well, I don't want to go out tonight, then it's, oh, but you poured yourself some orange juice. I thought you were fine. It's sort of a tough balance to find, but I really think it's the way that you convey yourself.
That is so true, especially when something being invisible, because I think, you can really seem so okay on the outside. That I dated someone for a few months, and I was telling him, oh, someone said I was such an inspiration, with narcolepsy, and he said, well, why would they find you an inspiration? Because it's so easy. There's nothing wrong with you. Even though he knew I had narcolepsy, and I had been so good about hiding it that he almost thought it was nothing, right? So it's sort of that balance of understanding that it is significant and communicating without complaining. And I'm the type of person that tends to go on the side of not wanting to complain, and so then I'm almost not communicating at all. So, definitely trying to find that balance of being like, I'm not feeling well, and making sure people know so that if it then affects our plans later that day, then they'll have some warning. That's been a tough part for me. So Have you guys had any consequences from disclosing this information? You know, where you were surprised by people's reactions and dealing with those consequences?
You know, I think that for me, particularly, the only consequences have come from the, sharing information with someone when I hadn't really thought it through on a personal level. But the vast majority, way over the not, people have actually surprised me with their humanity and the way that they still, you know, want to hug me and love on me and that sort of thing, you know. But I also think it comes from a personal decision to say, I am not going to let this affect me, and people see that and feel that, I think. And so, you know, if somebody tries to come at you in a negative way when there's so much positivity, they aren't they'll know real quick they're not in the right ring, because I'm gonna pin them 1, 2, 3. You know what I mean?
You are too funny. I love it. Jordan, did you have anything you wanted to add about that?
I've had a lot of unpleasant reactions just because, you know, a lack of education and sort of those sort of things. A lot of lost friendships, lost relationships, but, you know, looking back on it now, I don't think, you know, lost in the sense that over, but not lost in the sense that I'm missing anything. And I think that that's, you know, the number one thing to learn from those things is when those things end. Sometimes it's, you know, I hate to use the term blessing in disguise, but, you know, really sort of that. So, you know, you take the good with the bad, and you get to see some people's, you know, the people who will stand by you and those who won't. And I have incredible friends now that I'm so fortunate to have, and who, you know, really stand by me and don't, you know, question anything. And so I will take the bad experiences too, you know, because I'm so thankful for the good ones that I have now.
Well, you just gave me goosebumps. I mean, that idea that, oh, I don't want to cry. I'm a crier.
Cry, cry, cry.
No. You know, this idea that loss meaning that they're not there, but loss not meaning missing. I think that's so such a great message and a great way to end this. And you know, I think that our lives are still so full, and that, you know, we're not giving up, and we're finding the right people in our lives. So I think we should head back to Danielle here and to close us out on that note.
Oh my God, best hangout so far. You guys were so amazing. Especially, you know, Julie, you just did a great job. I know we had to cut off our second topic, main topic, but we had so much great content, both from the news topics as well as the first topic. Plus, we were laughing half the time, which is amazing to be having the education component come through. And then all of your amazing humor really lends itself to, you know, humanizing some topics and contents of a condition that sometimes aren't so fun. So thank you so much for being honest and sharing your stories. Julie, once again, amazing. And Josh and Jordan, great content. Thank you so much for joining us. I just wanted to update you guys that we are still in the middle of the third annual WEGO Health Activist Awards. And so we will have shows through Friday at 12 p.m. Eastern and 5 p.m. Eastern. So keep your ear to the ground for that, especially our final closing ceremony at 5 o'clock on Friday for the Health Activist Hero Award, which is always a favorite. But I think you all, I mean, not to be cheesy, but I think you're all heroes and just did an amazing job, and it really warms my heart. Like Julie was saying, I tear up a little bit just being able to hear everyone's story, and I also feel really grateful and like a special, you know, time for me to be able to interact with you on this, and that you felt comfortable enough sharing your story not only with me, but everybody who's watching. And I think that there are a lot of kids and adults and caregivers and people who are all over the country and all over the world who will hear your story either here or through your blog or through your video content, whose lives will be touched and changed. And you know, that is why I'm sure all of you went into this sort of advocacy piece of your work. So if you have any questions or you want to be a part of this or many of the other things that we do here, or you want to say hi to WeGo Josie here on my side, just email us at community@wegohealth.com. And we'll have another episode next month. And thank you so much, Julie. I don't know if you or Josh or Jordan had any other closing statements you wanted to make.
I just wanted to say thank you to Jordan and Josh and Danielle. I started this Narcolepsy Not Alone campaign, to remind each other that we're not alone. And now, I just feel like it's the Health Activist Not Alone campaign with you guys here, and that there's just so much of our messages that overlap. And hearing your stories, to me, is inspiring. And I still think that Josh and Jordan, you're both heroes. So I'm going to stand by that. So thank you guys so much for joining me tonight.
Thank you, guys. Don't forget, you said you were going to do the digital sleepwalk, okay?
Don't worry.
Thank you, guys.
Thanks, guys.
Amazing job, everyone. Thank you so much. And you are all heroes, and honestly make my job so worthwhile and so amazing, and make everyone here at WeGo Health. I mean, when I share all of the comments and shares and retweets that we've had coming our way, I mean, I know it's just another wonderful, wonderful piece of the WeGo Health Network. But we're excited to do even more and share even more. So if there's a digital health walk or something else you want us to take part in or promote, we'll be there in a heartbeat. So thank you all again. Have a good night.
Good night.
Night, Julie. Night, Jordan. Night, Josh.